It can be a challenge for parents to keep track of the vaccines their children need. Not only that, but doctors recommend different vaccinations at different times in a child's development. Doug Johnson looks at why the timing of vaccines is important to your child's health.
It may not be something that children look forward to once they know what to expect, but doctors recommend that children be given a series of vaccinations almost immediately after they're born to protect them from a number of illnesses.
So the immunization in children that's done in twice in their life. One is the early childhood, which starts, as you said, right at birth, and then the second time is in the adolescence.
Dr. Abbasi and other pediatricians say vaccines are the best way to protect children from highly contagious diseases. Vaccines work by helping a child's developing immune system produce antibodies that will fight infections. Health experts say when children are vaccinated, it means there are fewer people who could get sick and spread illnesses to others.
And the timing of those immunizations is based on the time in the child's life when they're most susceptible to it, or they're more likely to be exposed to those particular infections that we are trying to prevent.
The first 3 or 4 years of a child's life contains a wide range of recommended immunizations. Vaccinations begin at birth and follow a schedule of initial vaccines and booster shots later. That includes protection against hepatitis A and B, rotavirus, meningitis, strep, polio, measles, mumps, and rubella, known together as MMR, and diphtheria, tetanus, and pertussis, or whooping cough, the vaccine known as DPT. Another round of vaccinations are timed to begin around the time children start school. Laws in every state require some immunizations before a child can attend school. Being around a lot of children can increase the chances of catching something. That's also why there's another round of vaccinations when children become teenagers.
And as far as late in life, to give you an example, during the adolescence time period, meningococcal is one of the vaccines that we give. And the reason for that is these kids who are adolescent now and going to be going into college and will be in dorms and close proximity, they are higher risk for the meningococcal infection.
Scientists say there are fewer cases of a number of diseases because of vaccinations, including smallpox, diphtheria, and measles. But there have been questions over the safety of giving vaccines to infants. Dr. Abbasi says those questions have been answered.
But there have been many articles that have been written about the safety. Many studies have been done, long-term studies, which have shown that these vaccines are very safe.
But there can be side effects, including fever, rash, and joint pain after vaccinations. And because some vaccines are prepared with chicken eggs, parents of children with serious allergic reactions should talk with their doctor about whether to use those vaccines containing egg proteins. If a child has the same doctor during their entire childhood, it should be simple for parents to work with pediatricians to keep track of all the immunizations a child gets.
If they stay with one pediatrician, every time they come, we're going to discuss the vaccination schedule, and then we'll let them know when the next time they come what vaccine they'll be getting. But it's become especially important if the parents, they move or they change pediatrician, to make sure that they keep a copy of the immunization record so that when they go to a new pediatrician's office, they'll know exactly where to pick up.
And anytime parents have questions, they should talk to their child's doctor. For Smart Medicine, I'm Doug Johnson.